Hi everyone, my name is Miss Princess Joy Fetil Sepe, a student of Bachelor of Science in Midwifery at Camarines Sur Polytechnic Colleges. And I'm going to demonstrate administering injection, which is intradermal injection. There are two parts in administering injection. First is preparation and the second part is the procedure. For now, let us go for preparation. The first step in preparation is assess the client. First, check for clients' allergies to medication, as well the side effects and adverse reactions. In some cases, we can encounter some patient who doesn't know their allergies. As well, they don't have any experience or history of admitting on a hospital. We can do some skin tests or laboratory tests. The next step is to check for tissue integrity on the selected site. When we talk about tissue integrity, it is the ability of the skin tissue to regenerate and repair to maintain normal. After that, we can now check for the client's age and weight to determine the size of the needle to be used. In some cases, we can counter different patients, child, adult, infant, as well some stubborn patient. So in this case, it is important to know what is the size of the needle to be used. The last step in assess the client is check for the patient's willingness and ability to cooperate. So, sir, ma'am, we can start a convo to them so that we can understand and know their side. The second step in preparation is determine. Determine whether the size of the muscle is appropriate to the amount of the medication to be used on the patient. The third step in preparation is assemble equipment and supplies. Tuberculin syringe, sterile cotton swabs, surgical gloves, the vial or ampule, as well the alcohol to be used. The fourth step in preparation is to check for the MAR or medication assessment record. Once we've done all the steps in preparation, we can now go to the second part in administering injection, which is the procedure. So we're back. We're now on the first step on the second part of administering injection, which is the procedure. The first step in the procedure is to wash our hands and do some infection control. In some cases, where there is a water interruption, a bottled mineral water or a sterile water will do to wash our hands. Let me demonstrate. So this is a mineral water. Put some water into a clean basin. I'm doing this because we have water interruption in our home. So I hope you all understand. Once we put some mineral or sterile water on the clean basin, we can now dump our hands with water. Then put some antibacterial soap. Then gently rub it. And always follow the right and appropriate steps in washing our hands. Now we can rinse our hand. Using a clean towel, we can now dry our hands. After washing our hands, as you can see, I'm now wearing a surgical gloves and a face mask, which is also a part of the infection control. So, we can now go to the second step of the procedure, which is to prepare the medication that we're gonna use. The second step of the procedure, which is to prepare the medication from the ampule or vial for drug withdrawal. So in this step, We can get a cotton, clean, sterile swab, then grab the ampule or vial by the neck, which is the medication. Then, using the clean, sterile cotton swab, get swipe it on the head of the medication in a circle motion in a second, like this. The third step of the procedure is to provide for client's privacy. It is a must and important for it's part of the right as a patient. And also we, health practitioner, must always check the area to avoid disturbances and incidents during the procedure. The fourth step is check for client's information and identification. So, ma'am, are you okay? Your age is, and once we've confirmed the identification information of the patient, we can now position the client on its most comfortable position. The fifth step of the procedure is to explain the purpose of the medication to the patient as well by using a language that they can easily understand to inform them the effect of the medication. Once we've done explaining the purpose and effect of the medication to the patient, we can now select, locate, and clean the site. Once we select and locate the site, we should clean it. So we're gonna take a sterile, clean cotton swab, then clean the area. The seventh step for the procedure is to prepare syringe for injection. So I have a syringe here. Open here. Now open the syringe. Remove the needle cover without contaminating the needle. Once we're done preparing the syringe, we should hold the needle like dart and insert quickly and smoothly at a 90-degree angle. So this is the medication that we're gonna use, like dart, 90-degree angle. Hold the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back of the plunger with your dominant hand. Now, for the ninth step of the procedure, which is to inject the medication. So since this is an intradermal injection, we should always consider that the site of the injection must be less hair or it is comfortable for the patient. So, I am using and inserting this needle or syringe in a 15-degree angle since it is an intradermal injection. Imagine that I am injecting it into a real person. After injecting the medication, we can now withdraw the needle at the same angle of insertion. Apply gentle pressure to the site and please do not massage it. Get a clean and sterile cotton swab. Apply it to the area with a small and slight pressure on it. Then the syringe that we've done using, we shouldn't recap it. Activate safety precautionary measure. Place the needle on a toxic waste disposal bin to avoid infection and further incidents. So I'm gonna dispose it. Now, since we've done administering medication to the patient, we can now remove the gloves and wash our hands once again. There is a proper and appropriate way of removing gloves. So these two fingers, insert, slide, crumpled, then use the other fingers and then once we've done removing our gloves, we can now wash our hands once again. Now, we're on the final two steps of the second part of administering injection, which is the procedure. The 15th step is to document all relevant information, including the time of administration, drug name, dosage, as well the route and client's reaction on the medication. So I have a medication card here. I'm going to write the name as well, the route. And the last step for the procedure is to assess the effect of the medication to the patient on the estimated time it will be effective. So we can start a conversation to the patient, what they feel and if they think there is any reaction of the medication to them. So now that concludes my demonstration on intradermal injection. I hope you learn on I hope you learn something by watching me. Thank you and God bless.